This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everyone, and thank you for attending our Mather Hospital HealthyU. I'm Dr. Vinay Yahoo. I'm the Administrative Director of Mather Hospital's Back and Neck Pain Center. Today, we're going to discuss the sacroiliac joint and how that may be a contributor to your back pain or someone's back pain. I'll be speaking today. Caitlin Conville, our nurse practitioner coordinator and navigator at the Back and Neck Pain Center, will be speaking, and a physical therapist from our hospital, Zach Riggio. He'll be speaking about physical therapy and the role of physical therapy in treating sacroiliac joint pain. Next. So what is the sacroiliac joint? You might have heard this on TV. I know there's been a couple of commercials. I think Geico is one of them, or maybe Progressive had a commercial about the sacroiliac joint. So the sacroiliac joint is the joint that black arrow is pointing to. On the skeleton view, you can see that there's a red line between the bone we call the sacrum and that plate called the pelvic bone or the iliac crest. So that forms a joint. There's one on each side, on the right and left side. And then if you see the other arrow pointing to the body, you can see that it's down in the lower back area. It's actually beneath the lumbar spine, and there's one on the right and the left. Next. So just a little bit about Mather Hospital. The hospital is now nationally recognized. It's a magnet hospital, meaning that we've been given awards for our excellent nursing care. I think there's only about 400 or 500 hospitals nationwide that actually achieve that excellence rating. We're the only hospital in Suffolk County to receive A ratings from Leapfrog. I think we're actually up to 18 now. And in the spring, we were just awarded an A as well. And Leapfrog does analyses of all regional hospitals for high quality and safety. Healthgrades has ranked Mather as one of the top 250 hospitals in the United States and one of the top 29 across the United States for our emergency department. And we've also achieved the Beacon Award for top critical care. So you can see that Mather Hospital, which is now part of NORTHWELL Health, is a highly recognized hospital with excellent programs. Next slide. Okay, so back to back pain. 85% of the American population will experience back pain at some point in their lives. That's a lot of people. So it's very prevalent in society. 31 million Americans will experience low back pain at any given time. Low back pain is the single leading cause of disability throughout the globe. This has been ranked and published in the Global Burden of Disease in the magazine Lancet, which is a highly prestigious medical journal. And Americans spend, actually the number 50 billion there is actually not accurate. It's actually upwards of now $100 billion per year on back pain treatments. One of the biggest things about back pain is that its recurrence rate. It is estimated that back pain recurs 50% of the time within 1 year and 60 to almost 80% of the time within 2 years. And the reason for that is because, excuse me, there's lots of risk factors that go undetected or unmitigated, and people don't correct what's wrong with, which is what led them to that back pain episode to begin with. So back pain is highly prevalent and recurrent in society. And one of the ways to avoid that is to identify the risk factors that led you there to begin with, the perpetuating factors, and some of the medical and other comorbidities that allow back pain to perpetuate. Next slide. So here's an anatomical picture of the sacroiliac joint once again. And on your left picture where you see the woman there, you can see her pelvis. And now when we break down the pelvis, it's pointing to the two sacroiliac joints between the sacrum and the ilium bones. The lumbar spine sits like a building on top of that foundation. To your right, you can see the anatomical description on a skeletal model, and you can see it pointing out to that squiggly line, which is the sacroiliac joint, again, between the sacrum and the ilium. There's one on the right, one on the left, and very little motion occurs at that joint, but yet can cause a significant back pain source. Next slide. So what are some of the signs and symptoms of sacroiliac joint pain? So research has shown that this diagnosis, sacroiliac joint pain, is actually underdiagnosed. And it's actually in existence up to 25 to 35% of all patients who present with just lower back pain. Some of the symptoms include, as you can tell, back pain, but back pain that also goes into the buttock area and hip area, can actually cause radiation to the groin. You can actually feel thigh or calf pain. Pain tends to be worse when going from sitting to standing and going upstairs or turning in bed. It's actually extremely common, and we'll go over some of the reasons why. If you look up at the top right-hand picture where it says it hurts right here, that's typically the telltale sign. When we ask people what's causing your back pain or where do you feel your back pain, they typically point to an area in the lower back right over a bump, which we call the PSIS. And that's typically where the sacroiliac joint is, and they generally point to that area. Next slide. So what are some common causes? Well, you would think postural. I mean, if you're sitting all day long, if you're twisting and turning, mechanical reasons, trauma, falls, micro trauma. There are medical conditions that can cause sacroiliac pain as well, and they include Crohn's disease, gout, psoriatic arthritis, ankylosing spondylitis, and these are what we call inflammatory arthropathies. And then one of the most common reasons for SI joint pain, I'm going to refer to sacroiliac as SI, is that the people who get lumbar spine fusion surgery, almost half of the people that have chronic back pain after the surgery isn't due to the failure of the surgery or a recurrent herniation. It's usually due to stress below the level of the fusion, which is the sacroiliac joint. Another common reason is pregnancy and obesity. As weight increases forward, people will lean backwards, kind of like as a compensatory mechanism. And as you're leaning backwards, it puts a significant strain on that sacroiliac joint. And then lastly, leg length inequality. Some people are either born with a short leg, sometimes they can break their leg and the leg becomes shorter. There are multiple reasons for leg length inequality, but leg length inequality is definitely another common reason for sacroiliac joint pain. Next slide. So how do we diagnose or evaluate for SI joint pain? The primary method is through a clinical examination. And just like any other medical problem, diagnosing SI joint pain comes from the history, the physical exam, and particularly from the physical exam, provocative clinical orthopedic testing. Now, I'm not going to go over the 5 tests that we utilize, but you can see there are 5 different tests that we can use to isolate the sacroiliac joint. And if it reproduces somebody's pain over the sacroiliac joint area or some of the referred pain that they get, if 3 out of 5 of those tests produce pain, we have a clinical presumptive diagnosis of sacroiliac joint pain. So why is it important to isolate and pinpoint the sacroiliac? Because treatment is very different for whether it's the lumbar joints, it's the sacroiliac, it's a disc problem, it's nerve pinching, and clinical diagnosis is extremely important to point us in that direction. So what else can we use? Well, we can use imaging, we can use MRI, we can use x-rays. So if you look at the MRI picture over the imaging column, you can see the arrows are pointing to a whitened area. Now, you can see the sacrum in the middle of the picture. You can see the black ilium on the outside of the pictures, and the arrows are pointing to inflammation, or the white area, which we call marrow edema, is inflammation in the sacroiliac joint. Below that picture, you can see another picture on MRI showing white inflammatory changes around the sacroiliac joint. The joint is that black thin line between the sacrum and the ilium, and the arrows are pointing to inflammation around that joint. And then lastly, below that column on the very bottom is an x-ray. And again, to the left, you can see the sacroiliac joint. And now we're seeing white, not so much as an inflammation, but as what we call sclerosis, increased bone formation. In chronic sacroiliac joint pain, the body will produce extra bone, and that's what you're seeing on that picture. Excuse me, on the right-hand side, we can use ultrasound as well. And sometimes that'll help us see inflammation in the sacroiliac joint. And then lastly, a diagnostic injection on the very bottom, you can see the hypodermic needle. We're injecting lidocaine into that sacroiliac joint. And if that lidocaine helps relieve the pain, so even if you get 2 or 3 hours and you say, whoa, that really relieved my pain, that was diagnostic for sacroiliac joint pain. Next slide. So here's the stepped pyramid approach. We use a stepped approach to treating SI joint pain. So on the very bottom of the pyramid is conservative care. We always start with manual therapy, and that could include physical therapy, chiropractic care. The use of non-steroidal anti-inflammatories like ibuprofen, Medrol packs, which is cortisone pills. And then if that's not helping, then we move up the ladder to minimally invasive techniques. And we'll start with an SI joint block, which is what I just described before, which is an injection of anesthetic to see if that relieves the pain. If it does, then we'll do more of those injections to confirm it, at least 2. And then there's a technique that our pain management specialists use called an ablation. And we'll talk more about that later. And then lastly, if nothing on the bottom of the pyramids worked, and we are sure that it's SI joint pain, there's this newer surgical technique, which is minimally invasive and is called an SI joint fusion. Next slide. So conservative therapeutic options that we're going to talk about include pain management, and that includes ice, the use of ultrasound, electric stim, and medication. One of the things we try to differentiate is whether or not the SI joint pain means or has hypermobility or hypomobility, meaning sometimes the joint can get excessively mobile and it becomes unstable, or the joint becomes stuck and it needs to become mobilized. In the cases of hypermobility instability, we'll use a test to definitively diagnose that. And then if that's going on, then we'll use a sacroiliac belt. A physical therapy or chiropractic approach helps to mobilize or manipulate the joints in cases of hypomobility, where that joint is not mechanically moving, it's stuck, and as such, it's causing pain and inflammation, and then give the patient stabilizing and strengthening exercises to make that joint stronger. Next slide. So we're going to talk about the role of physical therapy, because as we said, in the pyramid approach, that's one of the first things we'll always utilize. And then we'll go on to talk about chiropractic medicine. Both types of modalities, physical therapy and chiropractic, are very similar, and I'll outline that towards the end. But I'm going to hand it over now to Zach Riggio. He's our physical therapist from the hospital, and he's going to talk about PT. Zach?
Hey, thanks, Dr. Ben. How's it going, everyone? I'm Zach. I'm the physical therapist here. I'm also a certified MDT therapist, which stands for Mechanical Diagnosis and Treatment. It's a type of therapy that we use to assess and treat the spine, which is used all around the world, very helpful in treating the patients that we see here, which is majority of patients with neck or back pain. Next slide. So what is physical therapy? I'm sure most of you have had experience with physical therapy, or maybe you know a relative that has had physical therapy, but it's a conservative approach that we're using to help decrease pain, promote mobility, improve your quality of life. Short answer is we're increasing your function, decreasing your pain, and trying to get you back to doing the things you want to be doing, while trying to prevent any new onset of pain and reduce any future onsets of pain. Next slide. So some of the benefits of physical therapy, just like exercise in general, it's good for you. If they could put it in pill form, it'd be the most widely prescribed medication out there, exercise. But some of the things we're doing is we're reducing your need to take pain medication. We're trying to avoid you needing any sort of surgery if possible, right? We're at the bottom of that pyramid, like Dr. Ben said. We're going to try the conservative approach first, so you don't have to go under the knife. We're going to try to improve your mobility, facilitate you, back to maybe whether it's your job or sport or something you want to be doing. Next slide. So use some general treatment techniques, that maybe apply to overall, physical therapy. We use different types of exercises. They're called therapeutic exercises because they're focused on treating an issue, whether it be stretching, strengthening, core stabilization, postural education, aerobic exercise. And then, as Dr. Ben said, also, we're using manual therapy techniques, soft tissue mobilization. We do joint mobs, muscle energy techniques, a bunch of different things, positional releases. And then, of course, sometimes modalities will help aid in that. And again, one of the biggest things is postural education, right? Or our patient education, I'm sorry, because we want you guys to know how to treat this issue, because back or neck pain has a high recurrence rate, right? It's over 50%. We want you guys to know what to do should it reoccur and how to manage it on your own. So that's a big piece that we often help patients with. Next slide. So physical therapy treatment as far as the SI joint, so sacroiliac joint. So some of the goals that we have for that are returning your SI joint to its normal alignment and mechanics. We're trying to optimize that functional stability. Like Dr. Ben said, if there's a little bit too much laxity within that joint, we want to try to make up for that using the muscle surrounding it. During the evaluation, we're trying to assess, for imbalances in those muscles, if maybe one side is stronger than the other. We're trying to assess if the joint itself is stable. We're trying to assess your gait and your posture, right? Those things can sometimes give us clues to something going on, right? If you're not walking correctly, or if you're not standing or sitting properly, it can help us figure it out. And the first thing we'll do, and I'll talk a little bit more about this, is we'll take a look at your lumbar spine first. Some treatment, as before, a lot of those same things apply here, just in a different area with different muscles. Next slide, please. So everyone knows there's importance for core strengthening because it's what helps keep your spine in a good position. It allows you to take on forces. Say you're wearing a backpack or you're holding something, right? You need a strong, stable base in order to prevent maybe a muscle pull or a joint going out of place or something like that. So it's very important that we work on these muscles with you during physical therapy. Next slide. So during the examination, as Dr. Ben said, almost the gold standard for SI joint, determining if it's an SI joint issue is that injection with lidocaine, but not always the first thing indicated to do. So during our examination, the physical exam, we're going to look at your lumbar spine first, just because there's a higher % chance that it's going to be a lumbar spine issue than an SI joint issue. Though it's still pretty common to have SI joint problems, it's slightly more common to have that lower back issue. So we're always going to rule that out first. So we're not jumping back and forth saying, is it a lumbar spine problem? Is it an SI joint problem? It just makes it easier to determine if it is actually an SI problem. Some of the ways we do that is through assessing how much motion you have. We might use, part of the McKenzie MDT assessment, where we're going to put you through repeated motions, again, to determine, is it coming from that lower back, or is it something, further down like the SI joint. As Dr. Ben discussed, he talked about that SI joint cluster of tests. While each of these tests are not as good at ruling in or out by themselves, when done together, and you have a lot of them that are positive, there's a much higher chance that it is, pointing towards an SI joint problem. Some other SI joint tests that we might do, sacroiliac hypermobility test is used to determine if you have a little bit too much motion within that SI joint, and perhaps you need something like an SI joint belt or more stabilization exercises for your SI. We might do a seated flexion test, which helps us determine, is it the right SI, left SI problem. Next slide. So again, some physical therapy treatments that techniques we might do. There's different ones for the SI joint. Some of them are called muscle energy techniques for a thing called a backward sacral torsion, which can be a little bit more common, where they think that the sacrum kind of pushes back a little bit. Again, we might do repeated motions for the lumbar spine, because a lot of times the lumbar spine, it connects down to the SI joint. When the lumbar spine moves, the SI joint moves as well to a certain extent. So we might be able to attack it from above or below, working on the lumbar spine, working on the hip muscles and different core muscles that attach above and below. Next slide. And here's just a few different variations of techniques that might be indicated for you. Again, a lot of these are working on stretching hip muscles, strengthening hip muscles, and core muscles, again, because a lot of these muscles attach above and below that SI joint and just help to kind of keep it nice and strong and stable. Next slide. All right, thank you.
Okay, thank you, Zach. Questions? There's a Q&A section on the bottom. If you hover your pointer, you can see there's a Q&A area. If you have any questions as we're going along, just go ahead and type them in there, or you can hit the raise the hand thing and we'll see that. But we generally take them at the end. So I'm just going to talk for a couple minutes about the role of chiropractic medicine. I'm a trained chiropractic physician, been treating patients for 39 years. So I have a little bit of expertise on the sacroiliac joint from our perspective. So next slide. So for those of you who've never been to a chiropractor, what do chiropractors do? Well, chiropractors are similar to physical therapists in that we use spinal manipulation or mobilization of the joints of the spine. And we have different ways of doing that. We can use it with our hands. You can see from these pictures on the top right and on the top left, that particular picture shows manual methods with the hands. On the bottom left, you can see there that doctor's using a mechanically assisted device which gently mobilizes the joint and sends reflex signals to the muscles to stop tightening. And then the techniques on the bottom, from the left all the way to the right, is called a Cox table. That's typically what I did the most. It's a table that mobilizes the joints, and it's very helpful for the spine. Next slide. So again, some of the common things that chiropractors do, particularly for sacroiliac joint pain, is on the left picture, you can see he's mobilizing the SI joint. If you remember, it's the joint between the sacrum and the ilium. And this is a manipulation procedure. Now, some patients can't have this done. They have inflammatory arthropathies. They have osteoporosis, a past history of maybe cancer. This is kind of risky. So we'll always use gentler and safer techniques like using gravity with those. You can see on the right picture, there's almost like a block underneath the sacroiliac joint. And we'll just use gentle mobilization techniques. And in those patients that have inflammatory arthropathies like gout or rheumatoid or lupus, a history of osteoporosis, we'll shy away from using high velocity techniques, which could be potentially aggravating a condition. Next slide. What other kinds of things do chiropractors do? Well, Zach kind of talked about PT uses modalities. Well, we do too. We use ultrasound, cold laser therapy. Some chiropractors use acupuncture, use nutrition and make nutritional advices. And we're going to talk about nutrition and the role of an anti-inflammatory diet a little bit towards the end. And then also recommend rehabilitation exercises, which are really important, as Zach said, to strengthen the core and particularly strengthen the muscles around the sacroiliac joint. Next slide. So one of the things that we also do, we use a biomechanical assessment of the SI joint. We want to be able to determine if the joint, the sacroiliac joint, is hypermobile or is it hypomobile. And in English, what that means, is there instability? Is that joint really sloppy and it's clicking and popping a lot? That's a sign of hypermobility. So we don't want to manipulate a hypermobile joint. We want to strengthen a hypermobile joint. And conversely, we want to look for a hypomobile joint or a joint that's stuck and the joint's not moving at all. So just as an example, the picture on the left and the right, we have our thumbs over the SI joint, and we're asking the patient to lift their leg. If the joint is stuck, the thumbs won't move. They'll go up with the person's leg. And that's kind of how we determine biomechanical stability of the joint. If we see that, we'll actually make a particular recommendation, which is best for that scenario. Next slide. If, an example, here's a sacroiliac belt. If we determine that the person's joint is hypermobile, meaning it's moving too much, the joint is clicking a lot, it's popping, it's very painful, and then we do our biomechanical assessment and we see that there's hypermobility, we'll typically shy away from doing any manipulative procedures. We'll talk about exercise, and we'll talk about a sacroiliac belt, which helps the body to heal and helps to achieve more stability of that joint. And this is typically after we've confirmed it with a forward bending belt test, like I described. Next slide. So chiropractors, many of you have probably been to a chiropractor. Chiropractors, 20, 25 years ago, if you'd asked the AMA, should I go to a chiropractor? The answer would have been definitively no. However, in the last 20 years, there's been a ton of research that's been published, random controlled clinical trials, which is the gold standard for clinical trials, to show that chiropractic care is very effective at treating mechanical back pain. In fact, studies that have been published in AMA journals have shown that it's statistically significant. So there's been a 180 on chiropractic and back pain. In fact, so much so that the American Medical Association, through many of its societies, the American Academy of Family Physicians, American General Practitioners, as well as the AMA, now put chiropractic as one of the leading things to try first. So we can take questions on this PT and chiropractic approach later. Next slide. I'm going to go on to talk about what happens if PT, let's say you've tried PT, you've tried a chiropractor, it's just not helping and I have this persistent pain. The first thing we'll do is in our center, our nurse practitioner will recommend that you see one of our pain management specialists. And the reason we want to do that is because we want to do a trial of an injection. Now, an injection, it's not like we're knocking you out for this. This is just like getting a flu shot. We're going to stick a little bit of anesthetic like lidocaine into that joint. And then we're going to look to see what kind of response you got over the next day or so. If you tell us that, wow, you know what, I felt a lot better. My pain went away for a few hours. That's actually very diagnostic. Now, we're not trying to cure your SI joint pain with that injection. We're just merely trying to see it, did we make the symptoms go away for a little while? If the answer is yes, then we'll do it again to be sure. This time we'll inject you with some lidocaine as well as some cortisone, and that might actually do the trick. So not only is it a diagnostic injection, it's actually diagnostic and therapeutic. Next slide. So if the joint pain comes back, we've done 2 of those blocks or those injections, and it definitely relieved your pain, whether it was a few hours, a few days. The next step would be something called an ablation. So it's like a needle. We stick a needle in towards those nerves, and we actually quiet those nerves by thermally ablating them. And what that means is we're kind of killing those sensory nerve endings. So you might say to yourself, oh my God, I don't want to get my nerves killed. But the point is that these nerves are just pain-conveying nerve endings. So what it does is it just quiets your nerve pain. I've seen it last 6 months to 2 years, and I've had a couple of patients that it's actually made the pain go away and never come back. One of the reasons why the pain never came back is because that patient was very motivated to make sure it didn't come back and was extremely compliant with doing all the exercises we told them that they had to do to make their core stronger. So not only did that nerve pain stop their pain, it actually, between the core exercises and the ablation, the pain never came back. That's not the norm, but it does happen. Next slide. And by the way, all of these things are done by pain management specialists that we work with at the hospital. They're called interventional pain management specialists that we refer you to. If in the event that none of this has worked, PT hasn't worked, chiropractic care doesn't work, acupuncture, massage, the injections, the ablations, there is a fusion technique that works. And basically it's very simple. It's minimally invasive. They go in, you can see in the far picture on the right, and they insert an object that binds the sacrum to the sacroiliac joint area by the ilium and the sacrum. And this is particularly helpful in people who have hypermobile sacroiliac joints. So we're fusing that joint, nothing else has worked, and typically this works pretty well in those extreme cases. Next slide. And again, that joint fusion is done by pain management specialists, not a chiropractor or a PT or the NP. So let's take a moment to just fill out this survey. And basically, this is something that we call the Oswestry Disability Index. Most insurance companies, including Medicare, require that spine pain practitioners get an initial Oswestry, because basically what it's doing is it's rating your functional pain and your functional ability to do things and your activities of daily living. So we're going to stop for 60 seconds here just to give everybody a chance to kind of score yourself. There's, I think, about 11 questions. Go ahead and fill it out. And then on the bottom, where there's the chat section, just go ahead and stick in there what your number was. We'll come back to this later. So we'll give you about 60 seconds to take a look at it and then just put that score in the chat section. While you're doing that, there was a question that came in. Somebody wanted to know if we're going to give you a copy of the PowerPoint, and yes, we actually will print out a PDF copy of this and email it to all our attendees. Okay, so we've given everybody a minute. Let's move on. Next slide. Next, I'm going to introduce you to Caitlin Conville. She's a nurse practitioner. She's our coordinator and navigator. And she's going to talk about her role in treating sacroiliac joint pain and back pain.
All right. Hi, everyone. I'm Caitlin Conville. I'm the nurse practitioner at the Back Neck Pain Center. I'm just going to tell you a little bit about our center, kind of our approach to treatment and some different approaches we take with diet that can also help with inflammatory conditions. Next slide. All right, so how is the Back and Neck Pain Center different? When you come into the Back and Neck Pain Center, we complete a thorough physical exam and take a very thorough history in order to identify the pain generators that are causing your condition. So there are many different causes of pain. In this case, we've been talking about SI joint pain. So that's something that we would want to identify during your visit. We put together all the pieces of the puzzle and we target the treatment towards the identified cause of your pain. And we also identify risk factors for chronicity and possible recurrence so that we can prevent future episodes of pain. So we want to get you better and we want you to stay better. At the Back and Neck Pain Center, we provide evidence-based multidisciplinary care, and that's customized by a clinical team, a collaborating physician, and guided by myself, the nurse practitioner. So talking about multidisciplinary care is just referring to the fact that we have multiple providers from many different disciplines, and that includes spine surgery, pain management, physical therapy, and chiropractic, and we all work together to coordinate your care. So we actually meet once weekly and we review patient charts to allow for providers from different backgrounds to weigh in on the selected treatment plan and provide their unique perspectives. Here we also aim to reduce recurrent episodes of back and neck pain by teaching about adopting a healthy lifestyle, and we'll talk a little bit more about that. We also avoid the use of high-risk pain medications. So while one of our goals, of course, is to alleviate your pain, we really want to find the underlying cause of your pain and try to target treatment towards that underlying cause. We also identify and address disparity of care factors. So there are many factors that make it difficult for individuals to access treatment. That includes things like financial obstacles, transportation issues, mobility issues, comorbid medical conditions, mental health issues. And here at the Back and Neck Pain Center, we try to identify those factors and provide assistance to make sure that you're able to get the treatment that you need. Next slide. All right, step-ladder approach to treatment. So this graphic here shows our approach to treatment at the Back and Neck Pain Center. So we use what we like to call a step-ladder approach. With this approach, we really aim to provide the least invasive, effective treatment option for your condition. So similar to what Dr. Ben was talking about with our approach to SI joint treatment. So for most people, this means starting with conservative treatment measures, and that can be physical therapy or chiropractic care. Now, if you've already tried conservative measures without improvement, or if your condition warrants further intervention, we may start a little bit higher on that ladder, and that may be with something like interventional pain management or the injections. In cases where you have red flag signs or symptoms that indicate an urgent condition, we may send you directly to a surgeon. So approximately 75% of our patients improve with conservative measures, but we continue to evaluate you throughout the course of treatment, and we recommend additional treatments or steps as appropriate. I would say about 20% of our patients utilize pain management treatment options, and about 5% have required spinal surgery. So our overall goal is to provide you with the most appropriate treatment and treatment that will be effective in reducing your pain and will help you to regain function. Next slide. All right, Back and Neck Pain Center support programs. So here at the Back and Neck Pain Center, we have support programs to provide additional care when needed. And two of these programs are the Mind-Body program and the Healthy Diet, Healthy Spine. So there were recent studies that were published in the Journal of American Medical Association that found that mind-body programs were effective for reducing pain and improving function in people with chronic low back pain. So here at our center, we can teach patients how to do deep breathing and simple chair yoga exercises. And that's an approach that's called mindfulness-based stress reduction, which helps to reduce chronic neck and back pain, as well as stress and anxiety. Healthy Diet, Healthy Spine is a program that involves an optional consultation with a registered dietitian. And during that consultation, you would discuss the importance of managing weight and how it relates to back pain, with a focus on anti-inflammatory foods that you can integrate into your diet. And that's just to help reduce inflammation in your body and thereby reduce pain levels. So we have a little picture here of the Mediterranean diet, and we're going to go on to the next few slides and just go a little bit more into detail with that. Next slide. All right, so I'm going to briefly talk to you about the role of diet and nutrition as they apply to the reduction and management of inflammation and pain. So on the left here, we have examples of foods that are not the healthiest foods in the world, foods that promote inflammation in the body and promote weight gain, while providing very few nutritional benefits. On the right, you can see fresh, colorful produce, high in antioxidants, vitamins, and minerals that serve to reduce inflammation in the body. So research shows that our diet plays a significant role in inflammation and pain. Inflammation is an important underlying mechanism for the development of chronic diseases, including type 2 diabetes, heart disease, arthritis, and cancer. And increased inflammation in the body is also found in patients with chronic pain. So by recognizing foods that can reduce inflammation, such as plant-based foods, as well as those that promote inflammation, we can make diet modifications that can decrease inflammation in the body and then thereby reduce pain. Next slide. All right, anti-inflammatory diets. So again, we have this food pyramid for the Mediterranean diet, which is an anti-inflammatory diet that provides excellent guidelines for how to make diet modifications to reduce inflammation in the body. So inflammation can either be positively or negatively affected by the foods we eat. Pro-inflammatory foods or foods that increase inflammation in the body include things like saturated fats, which is found in meat, especially red meat, whole fat dairy products, trans fats, which are found in like hydrogenated oils and in packaged baked goods and crackers, omega-6 fatty acids, which are found in oils such as corn oil, soybean oil, safflower oil, and sunflower oil, and in sugar and sugar-laden foods. So a lot of that processed food, that food in the center of the grocery store, those are typically the foods that increase inflammation in the body. Anti-inflammatory foods, or foods that help to reduce inflammation markers in the body, include foods that are high in omega-3 fatty acids, such as canola oil and walnuts, monounsaturated fats, such as olive oil, peanut oil, nuts, and avocado, fruits and vegetables and whole grains, the more colorful, the better, and many different herbs, spices, and teas. So definitely, having that guidance on diet and nutrition can help to just be another part of your treatment plan when it comes to having back pain. Next slide. All right, I'm going to hand you back over to Dr. Ben Eliyahu. He's just going to go over your back and neck pain risk assessment results with you.
So did anybody take a minute to fill that out or score it? I don't see any scores in there. So typically, if you in your mind did it, if you scored 2 or above, you should consider seeing someone, because that generally means that you have back pain that's not responding to whatever it is that you're doing, or it keeps recurring for a reason. And again, one of the things that makes our center unique is we look to identify the risk factors and the perpetuating factors of why things keep happening over and over again, especially since if back pain has such a high recurrent rate, there's usually something that's making that happen over and over again. And we really pride ourselves in searching for that, as well as giving you the answer to make it better. So if you score 2 or higher in that, that typically means that you have a high disability that's affecting your life from an activity daily living point of view, from a function point of view, playing sports, doing hobbies, simple things like yard work. And we want to try and help you. We take most insurances. And next slide. So just jot this number down. You can see on the top right, 631-686-2565. That's our central scheduling department. One of the biggest things that we do is we generally do patient satisfaction surveys on all our patients. And if you look at some of the numbers on the left-hand column, you can see that we've had very good success with helping people get better. 98% would recommend us, do recommend us to others. 96% have an overall satisfaction rating. 95% was satisfied with all the treating physicians that we refer to. So you can see that we have a very successful center, very unique. And we take a look, one of the biggest things that makes us different is we really take the time to diagnose your problem accurately. If we had a bow and arrow session and I blindfolded you and said, I want you to get the arrow in the bullseye, chances of that happening are slim to none. So it's similar in diagnosing and actually managing the problem. If we can figure out exactly what's wrong, we can tailor a treatment plan to exactly what's wrong to make sure that you get better. Sometimes so much time is wasted because we're trying different things, not us, but practitioners are trying different things on so many different levels to make someone better that don't work. All right, let's try this one. Let's try this one. Whereas we kind of pride ourselves on making an accurate diagnosis and getting the patient to the right provider at the right time for the right diagnosis. Next slide. So are there any questions at all about sacroiliac joint pain? And kind of along with what I just said, you can see the cartoon on the bottom right. It says sometimes pain can be indicative of other problems. The trick is the doctor has to be able to know what to look for. I don't think he sees it. This guy has a knife in his back and that's what's causing his pain. But joking aside, making an accurate diagnosis results in accurate treatment, which results in accurate results. And that's one of the things that we're known for at the Back and Neck Pain Center. Any questions at all? I'll wait a few seconds to see if anybody has any questions. Just go ahead and type them in on the chat section. Like I said, the previous question was, do we send the PDF to our attendees? The answer is yes. And just jot down that number if you'd like to see us. And if you scored more than 2 on that survey and you're having perpetual pain or someone in your family is, I would highly suggest you jot down that number and call for an appointment. Well, since there are no questions, I want to thank everybody for taking their time to tune in and listen to our HealthyU webinar on sacroiliac joint pain. I want to thank our speakers for taking the time to contribute to today's presentation. And thank you to Public Affairs at Mather Hospital for coordinating it and running it. Everyone have a good afternoon. Thank you.